Колеги,
Colleagues, welcome. We continue our work. Our next briefing will be about the topic which is of concern for 2 million of Ukrainians. Today we will listen to the report of Medical Commission on health of Nadiya Savchenko and introduce our panelist, Natalia Kharchenko, the main chief non-staff specialist of the Ministry of Health of Ukraine, or Andriy Strokan, deputy chief medical officer at Feofania Hospital. Larysa, Sokolova, head of the Neurology Department of the National Medical University, and Vira Savchenko, sister of Nadiya Savchenko, please. Let me speak Russian. Dear ladies and gentlemen, my name is Kharchenko. I'm Natalia. I'm a chief specialist on gastroenterologist and a specialist that was on the 14th of March. We tried to get to season number 1, Metro Skatishina in Moscow, to diagnose Nadiya Savchenko. We have all the documents, and the Consul of Ukraine in Moscow told us, and he put a lot of efforts for us to get to see her. But after 8 hours of waiting, near the CISO, we failed to get in. We left at night, but we continue. Our consul continued to work. And next day, on Saturday, we again were near the CISO, and around lunchtime, they allowed us to get in that institution and to see Nadiya Savchenko. When we walked in CISO, they provided all the documents and medical documents. And when we worked on the documents, we diagnosed Nadiya. There were 3 doctors present from the hospital. From the hospital they have in that CISO, and there was a guard and some officials. But in principle they gave us time and documents, so we studied everything in details, and the documents are quite detailed and show dynamics, and then we diagnosed Nadiya. We talked to her. Then we discussed the plan and those are suggestions which are compulsory for successful getting out of hunger. In principle, we found an understanding among Russian doctors and their tactics. What that was there before our visit, there was a correct direction. There were some nuances that they didn't observe or were not able to observe. There were some details that demanded correction of the tactics because there were some questions. And together with our colleagues, we discussed that, we outlined that we found understanding among doctors in that institution, and they promised that all our recommendations would be complied with. As to Nadiya, maybe it's emotional, but she's a very strong, very focused person, understanding the situation and her role and her road she planned to take. And very nice person. She said hello to everyone. We sent also a hello from Ukraine from all of us. If there will be questions, I will be happy to answer as you tell us. Good afternoon, ladies and when we went to Moscow, like you, we had different information. We didn't know what we would see, and we didn't know about the state of Nadiya, and that's why we went with some emotions, and especially after 8 hours near CISO the first day, and next day we were trying to understand the situation as well as we could, and coming out of the hunger, that's a very complicated thing, because coming out could be even more dangerous than staying on hunger. That can bring to different fatal syndromes, and that's why such people who sure must be in a special department, a medical department. I said there were some nuances, and Nadiya started to eat food, but in general, our commission, we think that her state of health is relatively good. Everything more or less stable. This I cannot give you more information because we were not provided. We have no agreement. So she is in a relatively good state, and but this is at the moment of diagnosis. What will happen tomorrow or in some time, we don't know about that, because as well we don't know about her plans and what will happen there. Thank you. Good afternoon. Hunger is a big burden on the body. All the systems that can participate, even nervous system, but I will have to say that Nadiya is in a good mental state and moral state, and she controls the situation. She absolutely adequate, and she understands clearly everything what is happening. But she needs moral support, of course. As we understand, it's very difficult to her to be there, and she's trying to express her protest with what she does. Unfortunately, she did not sign a refusal from hunger officially, and we saw a normal mental state and more or less good physical state, but we don't know what will happen afterwards, and she needs really support, different support, any support we can provide. Thank you. Thank you, Larysa, and please, sister of Nadiya, Vira. Good afternoon. Unfortunately, they did not allow me to see my sister, so I'm very thankful to the doctors and who were waiting there until the last, and they had to storm, almost had to storm the CISO. I didn't see her. I hope that her lawyers will see her today, and they will provide some news, and I will have meetings with those people who work on our military prisoners. Not official, but they do. And there will be a press conference in Berlin on the 22nd, and we'll fly with mother, because Germany is the country which has the biggest influence in Russia, and we will try to work with them. Thank you.
Question, please. Which Makievsky Novosti? If it's not a secret, who paid for your trip? And after you respond to this, I have a message that I want to transfer to Irina, to Vira. From what I know, the trip has been paid by the Ministry of Public Health Protection. At least we got tickets from them. Vira, I have a wish, if you want, from one of herbal tea producers. Here's the tea that they offer to you to share it with Nadiya as soon as she's out of jail. They hope that it will help her to restore. Thank you for this product placement attempt. Any other questions? Mikhailo Stekel, Radio Liberty. Am I true to understand that you are restricted in the possibility of delivering information about Nadiya Savchenko because it is the requirement of the penitentiary and correctional system there? There is the notion of confidentiality, medical confidentiality included, and informed consent from the patient, and there is the ethics code of medical officer. And in view of that, we can state that her situation is really said more or less satisfactory. She even added about 2 kilos to her body weight. But again, the situation may change anytime, though every one of us is keenly interested in her keeping alive and healthy. Thank you. Next question, please. Question from the Crisis Media Center to the sister of Nadiya. You know Nadiya probably most, and you know that many people have addressed Nadiya requesting and asking her to stop this hunger strike, from Mr. Gemilov to students who were on hunger strike on the Maidan Square. There were numerous requests for her to spare her life and health. Do you feel there can be arguments that one may use to convince Nadiya to stop this hunger strike, to remain alive and healthy for the sake of Ukraine? Nadiya actually responded to every such address, to every such request. This is a kind of the weapon she has, and it did work worldwide, not just for Ukraine and against Russia. I do hope for some changes for the best. I'm just holding my breath, expecting some good news to come, and I really hope that those people who do it, that they will be sane enough to end this mess. If they want to save their faces, their images, I can tell them how. So we tolerantly keep silence, trying to comprehend what happens there. We try to come to terms where Putin is, for example, and what happens in that country, and the situation is really fragile in this country. So it is not that we are afraid, we just want to break this rough equilibrium. Could you tell more about how has Nadiya managed to get 2 kilos of weight after this lengthy hunger period? She's been taking chicken broth, for quite some time. The additional feeding that she gets now is children formula, which is exactly the product that her body is able to digest at the moment. No hormone therapy, most probably not, because we didn't see it. But they say you cannot have broth when you're going out of hunger strike. There is an entirely other popular regimen when you have. I've been told by a medic professor, well versed in bringing people to break their hunger strike. He's 95-year-old. He's very professional. He told me how to properly feed such people. Thank you for this very enticing information on how to break hunger in people. I will use it definitely at some point. But coming back to Nadiya and given the reactions of her body that she doesn't have now, but they were registered some time ago. They were attributed to her probably trying to more actively break her hunger period. And again, I can repeat that there are no complaints from her at the moment, and she is more or less stable and in satisfactory condition. And the dosage of intake has been rationed across the day. So if she will continue eating, we do hope for the better. Corriere della Sera, Italia.
Organization like International Red Cross in your visit to Nadia, please.
Питання від італійського журналіста Corriere della Sera. Чому не залучали міжнародні організації, такі як Червоний Хрест, взяти?
Our visit was arranged by the Ministry of Public Health Protection and by the sister with active involvement of Nadiya Savchenko. Before us, Nadiya was inspected by German Medical Commission from Germany. What about the Red Cross? I have no information about that. Lina Miroshnikova, Komsomolska Pravda in Ukraine. You mentioned dangers of breaking the hunger. What are exactly the factors contributing to some dangers related to that? The breaking of hunger strike is dangerous because a person comes into a certain catabolic state that continues for some prolonged period of time. And this is really a balanced status. And when nutrients start coming, this is our conscious attempt to break this equilibrium, which brings about destabilization. If you check for literature, medical sources, and for information from penitentiary and correctional facilities in this matter, we may assume that 90-day long hunger strike is really quite a serious case. And if you check for very rapid hunger break attempt, you may see a refeeding syndrome, which is about drastic changes in blood electrolytes, leading to potentially arrhythmia and cardiac arrests and polyorgan failure and intestinal damage. Many people in this condition, when they attempt to quickly restore their diet habit after hunger, they lead themselves to really catastrophic consequences. And in this case, we may just confirm that given this hunger break schedule, Nadia's condition is really satisfactory, more or less. Any more questions? If not, then may we thank the doctors for their really valuable input, and please relay our warmest words of support to Nadiya at the next time you see her. Thank you again.